Welcome to Legacy Spine and Neurological Consultants. We are honored that you have selected us for your care provider. We've prepared this video for you to guide you through the process so you know what to expect every step of the way. Here's a list of a few important reminders. Please arrive 30 minutes prior to your appointment to complete the check-in process. We will need you to sign a consent form and sign an agreement that you have received a copy of our privacy policy and patient information forms. We are located in the Freeway Medical Building, 5800 West 10th Street, Little Rock, Arkansas. It's very important that you confirm your appointment within 3 business days prior to your appointment. There are 2 ways you can confirm. You'll be receiving a confirmation template to fill out 3 days prior to your procedure through the patient portal. You can find that by looking in your email on nextmd.com. Or you can call our automated phone line at 501-661-0077 and select option 3 for injections and then follow the prompts. If you don't confirm your appointment within 1 business day, it may lead to cancellation and no-show fees.
One of the little things I'd like to talk about is the allergies. We want to make sure that the important allergies for us are shellfish, latex, and iodine. If you have an iodine allergy, then we do things to pre-medicate prior to this. We will call in some medication for you to take and also go over a couple of other ones, Benadryl and a Pepsid for your stomach. If you're taking any anti-inflammatories or blood thinners, we're going to need you to stop those 7 days prior to your injection. We'll give you a list of the medications to stop taking, and that's also available on our website. We don't want you to stop taking any medications that your doctor has prescribed, especially if they're for your heart, unless we get consent from your doctor to do so. We are going to be giving you nitrous oxide if you wish for sedation during your ESI. It's very important that you do not eat at least 4 hours prior to your injection so that the nitrous does not cause you to get nauseated. You also need someone to drive you home. One more tip is for the Hibiclens, which is an antimicrobial soap, which can be used to wash the area on your back. We want you to do a 5-minute scrub the night before your injection and the morning of your injection. That just decreases your chance of getting an infection. If you have any questions, feel free to call us or on the patient portal.
Thank you very much.
So we will see you on the day of your injection.
Thank you for joining us today. We're going to talk today about spinal epidural injections for which you're about to, our gracious patient is about to have one here on his lower back. The epidural injections are a type of treatment that we offer as part of our minimally invasive approach to spine care. Spinal injections are typically done with steroid solution injected into the epidural space. This membrane here is called the dura, and the dura contains the spinal cord and the nerves. That dural membrane being above it is what an epidural means. So we're trying to put a needle in superficial to that membrane. We'll guide it into the interlaminar space, inject the medicine. So again, the goal, most of the pain perception is through inflammation in the nerves. Typically, we'll do anywhere from 1 to 3 injections over a 6-week period with the hope that the cumulative diminution of the inflammation of the nerves will alleviate the pain syndrome. The risks, one of the risks I showed you is that membrane is very thin. We're trying to get just above it, and just between the ligament and the membrane. This is a model, but in real life, this is just a millimeter or 2. I'm talking a hair or 2. So there's a very fine line, and so one of the risks of the procedure is that you can get a tiny puncture hole of that membrane, and that can cause a headache. It's called a spinal headache. Other risks of the procedure, you could potentially damage one of the nerves that you're getting near to with the needle temporarily. It can cause a shooting pain down the leg or arm if you're doing it in the neck. You could potentially damage the spinal cord if you are doing it in the neck or thoracic spine. In the lumbar region, the spinal cord is already ended in the anatomy in the upper lumbar spine, and there's just nerve roots. But they could be potentially injured. It's extremely rare to result in a serious neurologic injury. Very, very, very rare, but it's possible. There's also the risk of bleeding, and we try to take every precaution to minimize that risk by having patients discontinue any agent that are known to increase the risk of hemorrhaging, and that includes aspirin, vitamin E, any number of blood thinners that are given to patients such as Coumadin, Plavix, antiplatelet medications, Persantin. There's a long list of known medications, and then there's a list of medications that you really don't think about, like vitamin E. The goal of the procedure is to eliminate pain by reducing the inflammation. Typically, we'll do a series of 3 separated by 2 weeks apart. We're now starting the epidural injection procedure. As you can see, we have a C-arm fluoroscopy machine here that will localize exactly where we are. Our patient's lying face down and over a pillow to try to extend the lumbar spine to make the opening the biggest we can between the lamina. So we're going to prep here with some betadine solution unless the patient is allergic to iodine, in which case we would prep with some Hibiclin solution. We're going to start this with a nice wide prep, and the patient is being administered nitrous oxide under monitored care, and our x-ray tech is going to be shooting the fluoro for us. And we've got a nice clean prep here. We can see the interlaminar space where the tip of the needle is. Right here, this lighter area is the interlaminar space. There's the tip of the needle. Spinous process, pedicle of L5, pedicle of S1, and in most patients with severe arthritic disease, as in our current patient, this interlaminar space is very narrowed, and therefore the great help of having this fluoroscopy and the experience of operating on people's severely degenerative disease makes it an advantage to be able to find where we are trying to get. Now here's going to be a stick and a sting. This is the numbing medicine. It's a lidocaine that we've infiltrated to numb the skin, and then this needle is the special needle that allows us to get into the space that we're attempting to reach. And now we're going to shoot another fluoroscopy. You can see that the needle is now guided right into the interlaminar space. This syringe contains only air. This is called a loss-of-resistance syringe. It's going to be filled with air. We're going to use air as our indicator, but I can feel a change in pressure both at the tips of my fingers here as well as the feedback from the air. You can see that the air has now been released. I could feel it as the needle passed through the ligament and as the air passed into what we believe to be the epidural space. This is iodinated omnipaque. I'm going to inject the omnipaque into what we believe to be the epidural space. The black dye, that is 100% classic for the way it's supposed to look. We're going to go ahead and go into the lateral position, and you can see here, there's the lamina, there's the back of the vertebral body, and there is the dye. Perfect position. We will inject the dexamethasone solution. This is about 9 cc's of sterile saline mixed with dexamethasone. Goes into the epidural space. My patient could feel that as it went in because it is bathing the nerves, and so he almost certainly felt some pain down in his legs. He's nodding his head as the medicine bathed the nerves, and we removed the needle and we're done now. So how are we doing? Doing good. I got a thumbs up, all is good. The procedure is complete. We've turned off the nitrous oxide gas, and in just a moment, our patient will be fully recovered, and we are done. Thank you very much.